Good evening, everybody. Welcome to ATP Live. Today we are celebrating World Hypertension Day, and we are going to have one of our in-house doctor, Dr. Rotimi Adesanya, with us. He will be speaking on hypertension with us. Please, I would like us to invite our friends. Let's invite our family, her age mom, her age dad. Don't let anyone left out. And at the same time, kindly share with your family and friends who are not online right now. So it's going to be a well-educative, impactful section with Dr. Rotimi this evening. So please, I'm going to give us about 2 minutes more to invite our family and friends to join us. Dr. Rotimi, please, let's give 2 minutes for people to join us.
Okay, thank you for the invitation.
All right, sir, please hold on. Oh, good evening, Dr. Gbemi. I can see you. Thank you for joining us. Okay, we have 12 people watching us right now. So join me, everybody, as I welcome Dr. Rotimi Adesanya, our in-house ATP family physician. So today's show, let's put our hands together. Dr. Rotimi, you're welcome.
Thank you very much. Good evening, everyone. My name is Dr. Rotimi Adesanya, like our moderator, Mrs. Abimbola, have said. And I also want to welcome our founder, Dr. Gbemisola Boyede, to the platform. Thank you for giving me the opportunity to use the As a Pediatrician platform today. Thank you.
So Dr. Rotimi will be speaking with us on hypertension today. Like I said earlier on, please let's invite our family and friends to join us on the show. It's going to be a very impactful and educative section with Dr. Rotimi. So Dr. Rotimi, can you tell us more about hypertension? What are the signs we should look out for when we are talking about hypertension? What are the do's and don'ts about hypertension?
Okay, thank you very much, our moderator, Mrs. Abimbola. Yes, before we start the definition of hypertension, the symptoms, and the rest, today is a special day all over the world called World Hypertension Day, May 17th. Every year, the day is marked to raise awareness about hypertension, to raise awareness because the awareness is said to be very low all over the world. So the day is set aside to raise awareness, May 17th of every year. But this year, the theme is to measuring blood pressure accurately, controlling it so that one will live long. That is the theme for this year. 3 in 1. Measure blood pressure accurately, controlling it, and living long. So you can see that one leads to the other. When you measure your blood pressure accurately, you'll be able to move to the stage of controlling it, and one will be able to have longevity, living long. So I will start by the definition of hypertension. Generally, hypertension is simply high blood pressure. I'm sure there is nobody on our platform that have not heard of high blood pressure before. That is what we call in the medical parlance hypertension. When you go to the hospital, we have one of the major instruments that we use in the hospital, which is the SPIG, to check the blood pressure. The normal blood pressure should be less than 140/90 for anyone, irrespective of the age. It should be less than 140/90. Once it's more than that, it is said to be hypertension. There is also a range that we call pre-hypertension. If it's more than 120, but between 120 and 139 is said to be pre-hypertension. Those ones don't need drug until they get to 140, but there are ways that they use to control that, which we mention later. So also for the blood pressure, you'll have had something like 120/80, 120/80, 140/90, 140/90. You know, these are the language that we use. The 140 is a reading that we call the systolic, while the lower one is called the diastolic. The 80 is the reading that we call the diastolic. So we need to check our blood pressure because as of today, even in Nigeria, 76.2 million Nigeria are affected with hypertension. What are the symptoms of hypertension? Hypertension is said to be a silent killer because one may not have any symptom, but some normally have symptoms like, you know, tiredness, headache. Some may not be able to sleep well. You know, some may have low tolerance to work. Some may be fatigued. You know, some may not just know how the thing is doing them, non-specific symptoms, but many don't have symptoms. That's why we call it the silent killer. So those are the symptoms of hypertension. And what are the causes? In short, in 90 to 95% of people that have high blood pressure, we don't know the cause as medical experts. We don't know the cause. Such people, we said they have what we call primary hypertension. We don't know the cause, and 90 to 95% of the people that are hypertensive fall in these groups. But they have some things that predisposes them to the risk. We have the second group, which we call the secondary hypertension. This one, they have high blood pressure because of some of other problems they have in their body. Some have hormonal problem, some have kidney problem, some have problem with the heart. And also the children that was mentioned, also some children too that have hypertension falls under the secondary, because there is always one thing or the other, you know, that is attributed to this blood pressure. But for primary hypertension, there are what we call risk factors, things that predisposes one to having hypertension. I will start with the first one. The first one is the age of the person. You know, as we are growing old, it is said that as men ages over 50, you know, they have the risk of having high blood pressure. As women ages over 60, they have the risk of having high blood pressure, because in women, the hormone called estrogen produced by women, you know, protects them from having high blood pressure. But by age 60, most women will have lost that hormone. The hormone level, the estrogen hormone will have declined, and they don't have protection anymore against high blood pressure. So many women at that age may also be predisposed. We have what we call obesity. Obesity, women or men that are obese, their BMI, body mass index, is normally over 30. That's the ratio of the weight to the height. It's a risk factor for high blood pressure. Then we have sedentary lifestyle. In the past, you know, when we want to buy something in the market, either men or women, we take steps, we walk to the market to buy whatever we need. But now there is online marketing. We sit in the comfort of our room. In the past, we walk to the bank to make transactions, but now we sit in the comfort of our room without even moving an inch to do transaction. In the past, we go to post office, you know, to post letters, but now we don't even move an inch in the comfort of our room. You know, we use our laptops and our devices to send letters to our friends and family. You know, that sedentary lifestyle is one of the risk factors that has predisposed people to high blood pressure. Then also stress. Stress is one of the things that also predisposes one to high blood pressure, because when someone is under stress, some hormones are produced like adrenaline, catecholamines, and many others. These hormones also add to increase in the blood pressure. Then we have other we have other things, that are also a risk factor to primary hypertension, which I have not mentioned. Like some may have cholesterol. Those that have cholesterol is a risk factor. Those that have diabetes is a risk factor. Those that smoke cigarettes, those that are engaged in alcohol. Then salt, the common table salt that is present in every house. We have to always have restriction. It's one of the things that predisposes also high blood pressure. Also gender. It is said that high blood pressure is from several studies have been done. It's commoner in men than in women. So that's the risk factors that then we have complications. There are complications that people have, as a result of high blood pressure. In short, that's why we doctors are normally on people that have high blood pressure to control it, because we don't want them to have complications, because those complications may lead to death. Complications like heart failure, complications like heart failure, complication like heart attack, complication like kidney problem, complication like stroke, complication like blindness. These are complications that come from uncontrolled high blood pressure. So if anyone has blood pressure, we know anyone, we should encourage the person, to go to hospital to get care. Then how do we treat high blood pressure? We have pharmacological treatments and we have non-pharmacological treatments. For pharmacological treatments, no, let me start with non-pharmacological treatment. That is the use of not making use of drug, making use of things like our lifestyle measures to control our blood pressure. The first on the list is exercise. We should always take it a step to do exercise regularly. In short, the World Health Organization, encourages us to do exercise at least 5 times in a week, 30 times in a day, average of 150 minutes in a week. If you do this, our blood pressure will go down. It is said that for every 1 kg that one lose through the exercise, blood pressure will also decrease. Then we also have diets. We have what we call DASH diet. DASH is DASH, dietary approach to stopping hypertension. These are form of diet that we use to control high blood pressure. What do you have inside the diet? Plenty of vegetables, plenty of fruits, then low dairy products. There are some milk. They've tried to extract the fats from the company. We call them skim milk. Those ones are part of the DASH diet. Then low salt is also part of the DASH diet. If someone engaged in all this, definitely the blood pressure will be controlled, or the person may be able to prevent getting to the stage of high blood pressure. Then we are to reduce salt. Those that takes alcohol, they are to stop taking alcohol or to reduce it as much as possible. Those that smoke, because smoking, it is said that as cigarettes, especially nicotine, contain hundreds of chemicals, and these chemicals are harmful and injurious to the body. They increase the blood pressure. So people should quit from smoking and avoid other harmful habits. So that's the non-pharmacological method. Then we have the pharmacological method, which is drugs. There are so many drugs. In short, if I start counting, I can count up to 30 drugs that we use to control high blood pressure. But we look at the person holistically and choose the type of drugs that the person will use. But it is said in Africa, the drugs that work for us most is diuretics. These are some people call it water pills. When you use the drugs, it makes you to pass urine. So in combination with calcium channel blockers, example of such drugs are the nifedipine, amlodipine, that most of us know. And in some cases, we have to combine 1 or 2 of those drugs so as to get the result that we want. There are also other drugs like ACE inhibitor, lisinopril. There are other drugs that there are also other newer antihypertensive drugs. The newer ones are quite very expensive. Someone may need up to 12,000 in a month, for a month dose. That's like Vasartan. Those are under the group of ARBs, angiotensin receptor blockers. Example is the Vasartan, all this newer drug, Codiovan, and the rest. Those ones are quite expensive, but they have their benefits over the older ones. But the doctor is the one that will make the choice of the one the person will use. I must say at this junction that pregnant women, which is a larger percentage of the people in our ATP family, they also do have high blood pressure. We have two types. Some pregnant women, their blood pressure is already there before they got pregnant. But some, it is when they get pregnant that the high blood pressure will come. We call that one pregnancy-induced hypertension or preeclampsia. So, we are always worried about these categories of people because we can't use any type of blood pressure drugs for them. So we are normally very worried and we choose the type of drugs that we use for them. And our major fear about pregnant women having blood pressure is that there's a complication that is called eclampsia. Some women, when their blood pressure is too high, they will start fitting, they will start convulsing, they will start having seizure. And you don't want any pregnant person to have that, because once that happens, the life of the woman is in danger. The doctor will have to bring the baby out. Even if the baby is 1 day old or 2 days old, 20 weeks, 30 weeks, 40 weeks, irrespective of the age of the baby. Once a woman that has high blood pressure convulses, the baby has to come out in order to save the life of that woman. So these are what we have around the hypertension, high blood pressure. So I can take our responses as we go along the line. If I remember other things, I can say it. But let me also mention this. For the sake of our men that are on the platform, even our women, their wives, our wives, you should let the men know that, because a lot of men do stop hypertensive drugs because they believe that it affects their erections. The truth is that we have drugs that affect erections, but when we doctor prescribed, we don't prescribe those ones to men that are sexually active. But most men, from what they hear from other people, they will just stop using their blood pressure drug. But the truth is that high blood pressure itself affects erection. High blood pressure itself affects erection, not the drugs. Most time, it is the high blood pressure that is affecting the erection. So let's encourage our men to use their drug as often as possible. And let's also encourage our men to imbibe what we call adherence, to use the drug as it has been prescribed to them. Some hypertensive patients, we tell them, use your drug every day for 6 months, for 3 months. Some will only use it every other day. Some will only use it for 2 weeks. Some will only use it for 1 week, like that. So we need to encourage our men and women to be adherent to the drugs that they are giving, to use their drug as it has been prescribed to them. I think I may stop here. So if you have any question, we can get feedback from the floor before I move on. But in the absence of none, I can still move on. Thank you.
Yes, you should move on, sir. There is no questions yet.
Okay, we also have what we call hypertensive crisis. From the name, the crisis is an emergency. Some people are hypertensive, once their blood pressure just go up, some men, they may start convulsing. Some will have this headache. Some will have what we call utter sensorium. They will not just be able to be coordinated. They'll be restless. They will not be able to put themselves together. They'll be restless. They will not be coordinated. That's also part of the hypertensive crisis. Such people are needed to be admitted in the hospital. In short, we have special drugs that we use for them. We use intravenous drugs to control their blood pressures. We use drugs to control their blood pressure so that many of them will not have stroke, so that the high blood pressure will not cause stroke for them, so that the high blood pressure will not affect their kidney, so that the high blood pressure will not cause damage to them. We are normally very careful when we see hypertensive emergency, and we don't want any of our patients to get to this stage, because at this stage, if hypertensive emergency or hypertensive crisis happen, one may spend up to 100,000 in a day, because once you get to the emergency section where such cases are managed, you have to do echo, you have to do ECG, you have to do the test that we call electrolytes, urea and creatinine, you have to do cholesterol level, so many tests. You will have to do up nothing less than 20 tests if I want to count them one by one. And it's not even the number, but it's just the financial implication, because in this part of the world, it is out of pocket payment that is mainly used for our health sector. So the financial burden is more on such people, and some of them may not be able to comply and they may not get good outcome. So that's about hypertensive emergency. Then I also just want to mention this. Some of us, some of our members, or some people that have high blood pressure, some already have machines that we use at home. We have different types of machine we use. We have four major types of blood pressure machines that we use. The first is what we call mercury sphygmomanometer. That's the one that you see the nurse, stand on the table pumping the machine, in form of a rectangular shape that they normally close up. That is operator dependent. Is the health worker that can operate it. Individual cannot use it. We have what we call aneroid sphygmomanometer. That one is also, it's a mobile one, but it's also health worker dependent. It's the health worker that carries it around, because the health worker has been trained how to listen to the sound, where to pick the systolic and diastolic blood pressure. Then we have what we call digital blood pressure machine or digital blood pressure monitor. This is what most of us have at home. We just tie it around our arm. Normally, they are operated electronically via battery, and the thing will read and give us the digits in a way that we just understand it. We don't have to listen to any sound. So many people have this at home, and we encourage everyone that's hypertensive to try and get one at home. Those that are hypertensive, they need to get one at home, because it helps the outcome of the blood pressure. Because anytime you check it and it's very high, it's a thing you can also have a chat with your doctor. This is the readings that you are having, and your doctor may be able to save you, from getting to hypertensive crisis or hypertensive emergency. So those are the three. Then the fourth one, the fourth one is a special one. It's normally used in the laboratory, and this one is normally attached to the body. When it's attached to the body, it's here for 24 hours. When you are sleeping, it's reading your blood pressure. When you go to the toilet, it's reading your blood pressure. Wherever you are, the thing is reading your blood pressure. When you are sleeping, when you are walking, when you are awake, it's reading your blood pressure. This actually, we use it, to confirm whether the person blood pressure is real or not. I will later say what I mean, whether the blood pressure is real or not. So that's one that is called ambulatory BP monitor. Ambulatory BP monitor is normally attached to the body, attached to the arm. Then the person will hook it, to the body, carries it around for 24 hours. After 24 hours, it will be taken by the doctor, it will be read. So because I said earlier that it is used, to know whether the blood pressure is real or not. So that brings me to what we call white coat hypertension. From the name, white coat. Some of our patients, when they come to the hospital, at the sight of the doctor or at the sight of the nurse, at the sight of that BP machine, their heart will just start palpitating. When you check their blood pressure, it will be so high. But such people, when you check their blood pressure at home, it will be normal. So that is what we call white coat hypertension. At home, they are normal. In the hospital, it is high. It is called white coat hypertension. And we have the one that we call masked hypertension. The masked hypertension, when they are in the hospital, their BP is very high. When they are in the hospital, their BP is normal. But when they are at home, their BP is high. That means when they are in the hospital, their BP is being masked. But this normally brings some conflicting issues to doctors, whether to treat or not to treat. That's why we have that ambulatory blood pressure monitor that I mentioned that will read the blood pressure for 24 hours. So that one will help us to confirm whether it's just white coat hypertension that the person is having or the mask hypertension that the person is having. So that is the purpose of that ambulatory BP monitor. And we have people that have sustained hypertension, which is the one that we are even normally more interested in. In the hospital, the BP is high. At home, the blood pressure is high. That one is said to be sustained. And some people, their blood pressure is normal at home, is normal in the hospital. That is said to be normal, or what we call normotensive. We still have one we call hypotensive, but it's not part of hypertension. It's like the opposite of hypertension when the blood pressure is just too very low. So do we have any
Yes,
question
thank you
from
so
members?
much,
Yes.
Dr. Rotimi. We have questions now. So, for those that are just joining us, today is World Hypertension Day, and we have our in-house family physician, Dr. Rotimi Adesanya, with us. He's there to answer all your questions on hypertension. And for those people that has been online, please don't forget to share this video. Invite your family and friends to join us. We still have about 35 minutes more to go. So welcome everybody once again. Oluwatoyin Afolaran, welcome. Thank you for joining us. Ako Friday Ogejen, thank you for joining us. I'm seeing some people that doesn't have name here. Shegun Shuhab, thank you for joining us. So we'll start taking our question by starting with Ako Ule Friday. Friday is asking, can one be totally cured of hypertension?
Okay, Friday, thank you for that question. Well, the truth is that in hypertension, we manage the case. We manage the case. Hypertension does not really have a real cure, real in quotes. But what we do, our drugs is able to reduce the blood pressure, is able to prevent the person from having any of the complications that can lead to death, is able to prevent that person from having stroke, is able to prevent that person from having kidney failure, is able to prevent that person from having heart failure, able to prevent that person, from having stroke, is able to prevent that person from having blindness. So there is really no cure. But what we do is we manage the high blood pressure. Our drug, we use it to control it so that it doesn't get to a stage. The truth is that this one, we don't normally tell most patients because we don't want them to run away from the hospital.
Oh, sorry about that, sir.
Okay. Okay, can
Sorry
we
about
move
that, sir.
on?
Yes, sir.
Okay,
Yes,
thank
sir, we
you.
can move on.
Okay, I was saying that okay, there is no real cure for hypertension. We control the blood pressure so that the person will not get to the stage of complication. The truth is that blood pressure drugs are meant to be used for life, but the doctor can decide at any point in time whether the person will stop or not. But it's not the person that will stop by himself or herself. Thank you. Friday.
Thank you so much, Dr. Rotimi. So we have question from Shegun Shuab. Must one continue to take drugs even when the BP seems to have been regulated? Must one continue to take drugs even when the blood pressure seems to have been regulated?
Okay, if you are able to take your blood pressure to a normal level is when the systolic is less than 120 and the diastolic is less than 80. If you are able to achieve that for 1 year, your doctor may tail off your drugs, may either stop the drugs or tell you to use it alternate days, or your doctor may give you a long appointment that you come back in 1 year for him or her to see you. But if you are unable to achieve blood pressure that is less than 120 for the systolic, less than 80 for diastolic, you have to continue to take the drug continuously. But if you are able to achieve that, your doctor may stop the drug. Because if you stop at 130, the blood pressure will go back to 140. because that is now called what we call pre-hypertension.
Thank you so much, sir. Mr. Shegun, I hope you have the answers to your questions now. Akko Really Friday says, what is the causes of high blood pressure in pregnancy?
Yes, what is the cause of high blood pressure in pregnancy? Well, naturally, some women already have blood pressure even before the pregnancy comes in. Then some other people is as a result of some things that has to do with the placenta, that brings about the high blood pressure in pregnancy. Apart from those that already have it before the pregnancy, placenta, the things that has to do with placenta causes this high blood pressure in pregnancy. But the high blood pressure we have in pregnancy normally resolve after the person has delivered. If it is due to the pregnancy, within 6 months of the person, giving birth, the blood pressure will go back to normal. But some, their own has already been there before and it will always be there. Also, some we don't know why they have high blood pressure in pregnancy.
So it's not all of them that you know what causes the high
Yes.
blood pressure in pregnancy. You can't relate it to anything.
Yes, just like what we have in the normal population that we say 90 to 95%, they are from unknown cause. We don't know the cause.
Thank you, sir. Shokefumi Temitope Ajayi is asking, good evening, doctors. Good evening, Dr. Temitope. Thanks for all you do. Is 125/80 a sign of high blood pressure?
Yes, 125/80 is not a sign of high blood pressure. High blood pressure generally, in order not to bring confusion, is when it is more than 140/90. That is high blood pressure. But we have in between that we call pre-hypertension. Anyone that is more than 120, like this one I'm seeing 125, 120 120 to 139 is called pre-hypertension. So for Shokefun, 125 can still go to 120 or lesser. That's when we can say that the person is normal. This is pre-hypertension. So you need to start doing exercise. You need to start working on your diet. You need to start reducing the salt you are taking so that it doesn't go to 130 and it doesn't go to 140. But when you start those lifestyle, it will take it to what is less than 120. But 125 is pre-hypertension, not yet high blood pressure.
All right, thank
Thank
you,
you.
sir. So it's asking, please, can high blood pressure be cured? That has already been
Yeah,
addressed.
yes.
That has been addressed, please.
We manage high blood pressure. We manage it. There is no cure per se. We manage it. That's why people that have high blood pressure, they keep going back to the clinic every year. We have clinic like hypertensive clinic. People keep going back, every year. So because there is no cure.
Thank you. Please don't forget today is World Hypertension Day. That is why we are having this discussion today. Use the opportunity to ask all your questions. So, Mr. Shagwe is asking again, please, doctor, what are the foods one should avoid if
Okay, thank you very much. The food that you may need to avoid
wants
when the blood pressure is high, let's start from fatty meal. Because earlier when I mentioned the risk factor for primary hypertension, I mentioned those that have cholesterol. So any food that contains cholesterol is a no-go area. Let's start from egg. You have to try to reduce the number of eggs I wan eat, 1 to 2 in a week, not more than that. And if your cholesterol is already high, you have to avoid the egg yolk. You have to avoid red meat. Red meat contain cholesterol, which can also increase the high blood pressure. You have to reduce the amount of salt that is in the food. There are some food that you can actually take without salt. When you are frying plantain, you may not need to put salt there. When you are doing your corn, and some other things, you may not need to put salt there, and just take it like that. You know, when you reduce the salt, salt is also what you need to avoid. But I just want to strike this warning here from some of our patients. We notice that we have had things like that. I cook my food separately. I don't eat my food with other people. Some people, they will cook their food. They will not even put salt at all. I tell you that that's like living a miserable life, because you know, the tongue has been fashioned in a way to be able to detect such sensation as part of the what it will detect. So we don't say don't use salt, don't take salt, but reduce the amount of salt. In short, it is said that the salt should be less than 6 grams in a day. I think that's about 1 or 2 tablespoon, sorry, teaspoon in a day. Less than 6 grams of salt in a day. So what we are saying is that reduce the amount of salt. Not that you not put salt in the food. If you don't put salt in the food, you know, that food will not be palatable. So, and some of the things that we do, like some that do buy food from the road, like some that buy corn from the road, you know, after those women avoid their corn, they will now put it inside salty water. Let's discourage them. The corn, as much as it is good, by the time they put inside salty water, you know, they have made it to be dangerous to health. The other food that one we need to avoid anything that has high fat content, especially saturated fats, like vegetable oil. It has to be reduced. The alternatives to vegetable oil, you can use sunflower oil, you can use canola oil. Those ones contain more of unsaturated fats, but the one that contains saturated fats are more, you know, are not that healthy. So these are the food that one can avoid, you know, and the one that one should imbibe in. Fruits, vegetable are the ones that one should imbibe in. Those ones are very healthy. Fruits and vegetables. Thank you. Thank
Thank
you,
you so
Mr.
much,
Shegun Shoab.
Doctor. Thank you so much. So, Mr. Shegun has many questions. Please, can you put all the questions in one comment so that we won't miss them out? He's asking again, what is the best exercise routine?
Yes, the best exercise, if you are someone that have not been doing exercise before, please just start from walking. Walk, brisk walk 30 minutes in a day, 5 times in a week. You start from that. From there, you graduate to jogging. From there, you can graduate to jumping. From there, you graduate to other stages, you know, of exercise. You can even register in a gym whereby, you know, they move you from one level to the other, from the less to the moderate, you know, to the rigorous level. But WHO recommend moderate exercise 5 times in a week, at least 30 minutes in a day. And one of the moderate exercise is walking, brisk walking, walk early in the morning, you know, or walk later in the evening. The best exercise routine is to start with walking. Walk 30 minutes in a day so that you burn the fat from the body. Thank you, Mr. Shegun Shoab.
Thank you so much, Dr. Rotimi. Facebook user, we don't have your name. Thank you. Thank you for joining us. So Franklin AK is asking, how can a pregnant mom avoid the blood pressure from going high? I think.
Okay, the truth is that at times this can be outside the control of the person. This can be outside the control of the person, but once it is detected at the antenatal clinic, your first or second visit, normally for every visit, your blood pressure is checked, and once the doctor detects that it is high, the doctor will also check your urine to look for protein to be sure that that BP is not going to affect your baby. So once the blood pressure is detected, the doctor will have to place you on drug immediately. You know, we have to place you on drug immediately. That's one of the ways that you can prevent it from getting worse and worse. But we have drugs that are given to pregnant women. Thank you.
Thank you, doctor. Thank you. Mr. Shagun is asking again, must one continue to take drugs even when the blood pressure seems to have been regulated?
Yeah, if your BP is regulated less than 120/80 for 1 year, yes, your doctor will do that. Your doctor can give you drug break, can relax it and see you like every three months. But you must be able to achieve less than 120 for the systolic, less than 80 for 1 year, consistently every month for 1 year before the doctor will now say you should stop using the drug.
Okay, thank you. Um, One of the Facebook users is asking, white coat hypertension, are this referred to as blood pressure patient?
Yes, white coat hypertension, yes, we call them blood pressure patients. But there is a clause to that, if they can go and do the test I mentioned before, the ambulatory BP monitor is normally done in the big labs. They will attach that machine to the person and you'll be able to read the blood pressure for 24 hours. That one will actually tells us every minute, every hour what the blood pressure is. So that one will rule the fact that it's not just because the person is coming to the hospital. So, but white coat hypertension, we start placing them on drugs. Yeah, because we start placing such people on drugs because it's better to be safer than to miss such.
It's better not to take chances at all.
Yes.
Well understood. Thank you, sir. Malik Ola Ojetola, after using the blood pressure tablet, one will be going to urinate frequently. Does this frequent urination have effect on the body?
Okay, after using blood pressure drugs, yes, I mentioned the classes of drugs earlier. I said there is one that we call diuretics or what they call water pills. When you use this drug, because they act on the kidney, it will make you to pass urine. As a result, your blood pressure will reduce. So that urine is as a result the effect of the drug. But what we advise people to do so that the urination will not have effect, try and drink enough water. Because if you don't drink enough water, you'll be dehydrated, and dehydration can cause headache. Dehydration can make you not to be okay. Your cells in the body, they all need water to move. So those that are on diuretics or what we call water pills, they need to drink enough water, not too much water. They need to drink adequate water, which is 3 liters in a day. That is expected of someone adults. Thank you.
Thank you, sir. Thank you, Malik. I hope that is well understood enough for you. We are going to be a little bit faster now. We have a couple more questions to go. Okay, Franklin Eke is asking again, how can a pregnant mom avoid her blood pressure from going high?
I think we have addressed this.
We have, we have,
Yes,
we have
yes,
addressed it.
yes.
We have addressed it. So another someone is asking, what leads to sudden high blood pressure in pregnant women?
Okay, let me just answer this question this way. When a woman is pregnant, there are some changes that happens in the body. There are some hormones that just come into force. Some of these hormones, like adrenaline, cortisol, they increase, and this hormone also self, they are also responsible for making some women to have high blood sugar, to have diabetes in pregnancy, because those hormones, they counteract the normal working in the person. So those hormones are what we make lead to sudden BP. It depends on how the body is taking it, but not everybody will experience that.
Hmm. Thank you
Thank
so
you.
much, Doctor. Yeah, thank you. Someone is telling us keep the good work, Doctor. Thank you so much. And
Thank you.
another person is asking, Doctor, you mentioned that high blood pressure prevents stroke, but my mom just had one last week, despite the fact that she takes her high blood drugs religiously. Please, what could be the cause?
Okay, the causes of stroke are many, but in our own environment here, blood pressure is number one. Diabetes is also there, and there are also other conditions that also leads to stroke. But in our environment, the two commonest causes are blood pressure, and diabetes. So somebody that have high blood pressure and drugs may have stroke if the blood pressure is not controlled. Is actually if the blood pressure is not controlled. So when someone is on drug, you have to review the drugs with your doctor. Even if the doctor notice that the drug is not making the thing to be controlled, the doctor can actually increase the drugs from 1 to 2 or to 3. Sorry about the fact that your mom had stroke. It could be from other causes. There is also diabetes as a cause. There are some also have infection, that leads to stroke. So it's not only blood pressure. But sorry about that. I will encourage you. We need to take her to see a neurologist, who will be able to address the issue. And she also need the care of a physiotherapy who will be able to assist and help her. But let her continue to take her blood pressure drugs. The blood pressure, apart from causing stroke, it can also affect the kidney, affect the heart, and cause other problems. So we pray that God will help her to get out of it, but try and see neurologists as we have advised.
Thank you so much, doctor. Thank you so much. We are sorry to hear about your mom. Just do as doctor has advised you. Thank you. Mr. Shegun, I think all your questions have been answered now, if I am right. And if there's any other question, I'm sure I'm going to see them as we proceed with the questions. Thank you, Dr. Bimsola. Olubunmi Omowumi, thank you so much. You're welcome. Mr. Shegun, food to avoid is one, if one is hypertensive, and what are the best exercise routine? This has been addressed. Thank you. Yes, it has been addressed. Akole Friday Ojechain. I remember when I was pregnant, my blood pressure usually increased in the hospital. Why? White coat.
Yes. Okay, let me start by number 1. Pregnancy is a stress on its own. We have said that stress is one of the risk factors for blood pressure. Then when someone is under stress, the hormones are increased, adrenaline, catecholamines, and many other hormones increases. So the same way, when a woman is pregnant, many hormones are in action, different one working. So this could also be the cause why you have blood pressure when you are pregnant. And you said it normally increases in the hospital. Yes, if it increases in the hospital, especially in pregnancy, your doctor has to start you on drugs immediately, because no doctor will want anything to happen to the unborn baby. No doctor will want anything to happen to the mother. Thank you.
Thank you so much, doctor. Shoma Muto, what side effects should we watch out for when taking high blood pressure drug? My husband was dizzy and his system was messed up. He stopped taking it and hasn't gone back to the doctor. What do you think?
Oh, Shoma, well, you have a lot of work to do on your husband. Since you are the closest person to him, you are the first doctor to him, so you have to encourage him. If the present one is making him dizzy, he has to go back to the hospital for follow-up. Like I said earlier, we have over 30 blood pressure drugs, more than that. And so we now have to look at the person holistically and look at the one that the person will respond to. I tell you, even though if the one that is using is making him to be very weak, the doctor can either reduce the dose by making it half, or the doctor, if the drugs is using is more than one, the doctor can reduce it to 1. And also now we have newer antihypertensive drug that doesn't make people to get dizzy, that doesn't have such side effects. The doctor can also recommend those ones for him, provided he's able to afford it every month. Those ones, it may cost him up to 10,000 every month, to get those. So you need to encourage him to go back to the doctor. You also need to encourage him to do some tests. I didn't mention the test earlier. If you still have opportunity before we close, I will try to mention the tests that one we need to do. So try and encourage your husband, to do the needful. He needs to go back. BP can be dangerous. BP cause damage to the organs in the body. So it's better you encourage him to go back. The doctor will work on the dizziness and will reduce the dosage of the drugs he's taking. Thank you.
Thank you, Dr. Rotimi. Mr. Shegun, thank you. You're welcome. Mr. Malik, we have answered your question. Does urinating frequently due to blood pressure typically has side effect on the body system. We have answered that. Thank you. Mrs. Sandra Anere again. I'm going to read your question as soon as I get to where it is. Omolara Gbolagade Rukayat. I heard the blood pressures of slim people differs from short people. How true is that, sir? For instance, slim people having 120/80 and the latter having 140/90.
Okay, in order not to cause confusion, WHO for adults, any blood pressure that is more than 140/90, it is high. Any blood pressure that is less than 140/90, it is normal, irrespective of whether the person is slim or the person is chubby. But one thing I must mention, obesity, that is BMI of over 30, when the weight is the ratio of the weight to the height is just too much. Such people are normally fat, you know, that one will make the blood pressure to be high. So obesity is a risk factor for blood pressure. So most people that are fat, they tend to have high blood pressure. So that may be the reason. So you encourage, such people to try to do exercise, to try to work to reduce their weight so that their own BP can also come to the level of like 120/80. Some slim people also have very high blood pressure, 160/90 and the rest. So it's not a function of whether slim or chubby, even though obesity is a risk factor for high blood pressure. So normal blood pressure for anyone, whether slim or fat, is less than 140/90. Some fat people also have blood pressure that are less than 120/80. Thank you.
Thank you, sir. Thank you, sir. This Facebook user is asking, please, sir, what causes protein in urine during pregnancy?
Yes, not only during pregnancy. Normally, when someone has blood pressure, one of the things that regulates our blood pressure through several hormones is the kidney. And the work of the kidney is for excretion. When all our waste products get to the kidney normally remove the things that are good and take it back to the system. Things like the protein, they are good for the body. Kidney normally take them back to the protein. But some kidney, because of the effects of the high blood pressure on such kidney, they will not be able to take all the protein back. So such protein are normally wasted in the urine. And when we see that in the hospital, whether in a pregnant woman or in somebody that is not pregnant, we are alarmed, we are worried. We now start checking the person's kidney, that could there be any problem with the kidney, or could it just be because of the blood pressure that happened in the pregnancy. So protein in urine occurs in pregnancy, also occurs in those who are not pregnant. Is a sign that that blood pressure has to be controlled before it does damage to the kidney. Thank you.
Thank you, sir. We have less than 10 minutes, Dr. Rotimi, so we need to be a little bit faster with the answering of the questions. So Mrs. Sandra Anere again is asking, I have a low blood pressure. I have a low blood pressure. Blood pressure is always low, and advised to keep taking Coke.
Okay, low blood pressure is blood pressure that is less than 90/60. But generally, some few people in the population, they are in the lower percentile. They are in the lower group. When you categorize the population, they just have low blood pressure, but they don't have any complaint. It doesn't affect them in any way. But there's a category of people that have low blood pressure, which is blood pressure less than 90, systolic, diastolic less than 60. And in such people, they will start feeling dizzy, they will start feeling weak, they start feeling tired. Such people are the ones that will actually say their blood pressure are low. And there are things that causes it, like those that are bleeding heavily, somebody that is stooling and vomiting, and some have other problem, other hormonal problem that cause low blood pressure. The advice to take Coke is a wrong advice. Please, on our page, we advise all our members, nobody should take Coke to cure blood pressure. Coke is never good to anyone. Coke does not cure low blood pressure. Coke does not cure low blood pressure. We treat low blood pressure by looking for the cause and treating the cause. Coke can even add to the problem because Coke contains caffeine, and caffeine, can affect the heart. Thank you.
Thank you, sir. This Facebook user is asking, how can protein in urine can be cured in pregnancy?
Yes, it's simple. Once the blood pressure is cured, the protein in urine will disappear. Once the blood
Okay.
pressure is controlled, the protein in urine will go.
Mm. Thank you, sir. At what week? At what week is a woman giving vitamin A after delivery?
Okay, women, breastfeeding women are normally given vitamin A, to support, their children. It can be given once they start breastfeeding from the first week. The reason is that children that are less than 6 months, you don't want to give them vitamin A because that vitamin A can affect them, but we give the child at 6 months. The first you give vitamin A to the child at 6 months, but the mother can take it from the first week. Women that are breastfeeding, they take the vitamin A so that the baby can get it from them, but the baby can only take it the first dose at 6 months.
Mm. Thank you so much. Please, you can check. You can, for the woman that is asking about vitamin A, kindly go to our Facebook group and type in immunization schedule or vitamin A. You are going to have more professional comments there that you can read on. So that will give you more knowledge about it. Okay. Franklin AK, can sleepless nights cause a pregnant mom blood pressure to be high?
Yeah, sleepless nights is a stressful period. You know, if you don't have enough sleep, you are under stress, and stress is one of the risk factors for pregnancy. Yes, it can cause that, but it's not a major cause in pregnancy. It's not a major cause in pregnancy, but it can add to it because it's a stressful period.
Mm, thank you. So I've been waiting for someone to ask this question. And Abiodun Adewumi Adesanya Adeleke is asking. But I'm going to add some questions to our question. Dr. Rotimi, please permit me. Can children also have blood pressure? So I will now ask, please, on our Facebook group, Ask the Pediatrician, we used to have this common question that people ask: can a pregnant mom with high blood pressure still take their medication? Will they have effect on the child? Please, I would like you to be more elaborate about this, sir.
Okay, if pregnant women should take their blood pressure drugs.
Drugs. And also, can the children have blood pressure? At what
Okay,
age? What are the causes,
okay,
the symptoms we should look out for?
okay. Yes, children can actually have blood pressure. When I did the classification of blood pressure earlier, I said we have primary and secondary. Children that have blood pressure is normally secondary. They have other problems in their body, like hormonal problems, like kidney problems, like heart problem. Such children, they normally have high blood pressure. So when they have high blood pressure, when it is then some children are obese too, they have high blood pressure. So when they have high blood pressure, the first thing the doctor will do, the doctor will try to look holistically at their organ by doing a body check for them. So if the doctor notices the problem is from the kidney, the child will be sent to see a pediatric nephrologist who will attack the blood pressure by taking care of what the problem is with the kidney. The same thing with the hormonal. We have to see a pediatric endocrinologist who will now address what the problem is, and the same thing with obesity. A child that is obese, they will have to check the cholesterol, do so many tests for the child to be sure that these are not the things that is making the children to have BP. In summary, children do have BP, but their own BP is secondary. It's caused by other problems they are having in the body, and they are normally referred to specialists, even subspecialists like pediatric endocrinologists, pediatric neurologists, or pediatric cardiologists. Those are the people that manage them because their own BP are normally secondary. Then the second part of the question, that if you said if a pregnant person refuses to use the drug, I didn't get the question well.
No,
Is
if
it
a
if
pregnant person is on hypertensive drugs
drug?
and they are
Yes.
breastfeeding, is there any effect
Okay, yes, for pregnant
on the
women.
child?
Okay, for pregnant women, yes, we have the classes of
Yes,
drugs
sir.
that they can use when they are
Mm.
breastfeeding. No, sorry, as a woman that is already delivered, you cannot be pregnant and be breastfeeding again. So for pregnant women, the drugs they use in pregnancy will not affect their baby in any way. We have special types of drugs that we use for pregnant people. Part of the drugs are nifedipine, Adomet. These drugs are only prescribed by the doctors. It's not to go and a pregnant person cannot go and buy blood pressure drugs. Those drugs are, prescription drugs. Then a woman that is breastfeeding, we have the type of blood pressure drugs that we give them. For example, the diuretics, the water pills, like all these diuretics and the rest, those ones that make people to pass urine. We don't give them to pregnant women, because if you give it to we don't give them to breastfeeding women. If such is given to a woman that is breastfeeding, the breast will dry up. So it's the doctor that gives the drug, and we have drugs that are safe for them. We give it to them so that it will not affect the baby. So that's why a breastfeeding mother who notices the BP is high has to see the doctor at the postnatal visit, and continue to see the doctor if the BP is high for the next 6 months, while breastfeeding. But there are some that we don't use, like all those ones that dry the breast milk up. Thank you.
Thank you so much, sir. Our time is fast spent now, so let's try and take maybe one or two more questions before we go. So please, for as many people that we are going to ask, we are not going to attend to your question. Kindly post your question directly on our Facebook page. Post it directly. You can post it on our family ATP family group. You can post to our family group, and likewise, if it is child-related question, you can post them on Ask the Pediatrician Foundation's group as well. Thank you. So we are just going to take maybe one or two more questions before we go, Dr. Rotimi.
Thank you very much.
This Facebook user is asking, how can high blood pressure be prevented during pregnancy, sir, and also blood glucose level?
Yes, once the blood pressure happen during pregnancy, it has already happened. You need to see your doctor regularly. In short, if at the stage of your pregnancy you are being seen every month or every 4 weeks, the doctor will have to reduce it to every 2 weeks. If you are being seen every 2 weeks, the doctor will have to reduce it to every week, so that they'll be able to help you to monitor the blood pressure and help you, also in preventing it. So that's the only way I will say it can be prevented. The other ways are outside our control. The other causes, because they're outside our control, one may not be able to prevent it. Then the same thing with the blood glucose level. Once it has happened, that means it has happened. You may not be able to prevent it, but what you do to control it is to make sure that you regulate your diet. And you see doctor regularly, because both the blood pressure in pregnancy and high blood glucose level, which is diabetes in pregnancy, they are not too friendly to pregnant people. The last few weeks is normally very dangerous, because some women may lose their baby. So that's why most doctors, by 36, 37 weeks, they quickly bring the baby out, so that the blood pressure or the high sugar level will not affect the baby. Thank you.
Thank you, doctor. Thank you. Precious is asking, good evening, doctor. How often should blood pressure medication be taken?
Yeah, most blood pressure medication are taken daily, but some are taken like twice daily or so, but most are taken daily, so that the people will be able to comply with it.
Okay, thank you. Stephanie C. Felix, good evening, doctor. My mom has high blood pressure, diabetics, and heart disease. Please, can we put her on Septrin daily for life? And how many milligrams?
Okay, your mom has high blood pressure, diabetes, and heart disease. I think the best thing, because these are 3 medical conditions, this actually require a specialist. It requires a specialist to see your mom, and you follow your mom up. Self-medication will not work in any way. So you need to see a specialist with your mom, so that the blood pressure can be controlled, the sugar level can be controlled, and the heart disease, most likely from the blood pressure and the diabetes, the doctor will be able to help you to control it. Septrin does not have any role in control of high blood pressure, diabetes, and heart disease. Thank you.
Thank you, sir. So this is going to be our last question. Shitaram Victoria Dike. What causes hypertension after delivery for someone who has never had hypertension before?
Okay, someone who has never had hypertension before and the person deliver and started having high blood pressure, I tell you, labor period itself is a very stressful period. You know, the delivery itself is a very stressful period, and the time you start nursing your infant is a very stressful period. So some conditions that have transpired during that period, you know, could make the blood pressure to rise, especially if you have a very eventful delivery, a traumatic delivery. You know, it could make your blood pressure to rise, the pain itself. But such blood pressure, if they are not there before, they are normally transient. After 2 weeks, by the time you are seeing your doctor for the postnatal visit, the blood pressure may not be there. But when the blood pressure is there, you need to seek the help of a doctor.
Thank you so much, Dr.
Thank
Rotimi.
you.
So we have to stop here. I'm so
Yeah.
sorry for as many people that have joined us. Kindly
Thank
post
you.
group and also ask the pediatrician, and our professionals will be there to answer all your questions round the clock, 24 hours, Monday to Saturday, every week. Thank you so much, everybody. Thank you for joining us. Before I go, ATP goes to school 2021. I'm always excited to see us go out on the field to do some outreach, and we have started our planning. TikTok planning is growing. Please, we need your support. We need your support for as many people on our group. Nothing is too small. You can give us 1,000 naira, 1,000 naira. Because ATP goes to school is on, and just on Sunday we launch our Ghana branch. So ATP has gone international. So I'm so excited. Anyway, I love seeing us grow. So thank you everybody for joining us. Dr. Ritim, do you have anything to tell us again?
Well, I will first thank our moderator, Mrs. Abimbola, for the wonderful session that we have
Thank
had.
you.
Thank you for coordinating the whole thing from the beginning to the end. And I also
Thank you,
want to
sir.
thank every of our members who have contributed in one way or the other. Just like she has also said, ATP goes to school. We need your support. We want to take COVID-19 education to the schools all over Nigeria and also in Ghana, like you have been told that we now have ATP in Ghana. We need your support. You know, no amount is too small, no amount is too
At
big.
all.
Thank you all. Take care of your blood pressure. Till we see next time. Thank you all.
Thank you everybody for joining us. See you next time. Bye bye.